There are many health risks associated with obesity, including cardiovascular disease and diabetes. So when looking for help, it's important to turn to an experienced, licensed medical weight loss provider. Joining me now from Age Rejuvenation is obesity medicine and bariatric certified nurse practitioner, Allison Arnett. Allison, welcome to Bloom.
Thank you.
So Allison, talk to me about the different weight loss drugs on the market and how you use them to help folks.
Yes, so the most significant ones that everybody's talking about, of course, are semaglutide and tirzepatide. And so there are similarities with these two, and there are differences. So when deciding which one of the two to use, there are so many decisions that we have to make when we're picking one for a patient.
And can you share about how these medications work to help people lose weight? And I understand they also do an incredible job of helping to lower blood sugar levels.
Correct. So I always share with patients about metabolism. So I make it simple. When we eat food, the purpose of that food is to become energy that gets into all of our cells, and insulin is the key that makes that happen. These medications improve our insulin sensitivity at the cell level. So that's how it helps the blood sugar and helps our metabolism, helps us to lose weight. It also slows the transition of food from our stomach to our small intestine, so we feel full longer, and it connects with receptor sites in our brain so that we don't feel hungry and we don't have food noise and cravings.
And what are the differences between the two major drugs on the market now?
So semaglutide, which is a pure GLP agonist, tends to slow the transition better than tirzepatide. Tirzepatide, on the other hand, doesn't seem to have as much nausea associated with it as the semaglutide because of that. Additionally, tirzepatide tends to improve inflammation all over the body better than semaglutide, and people who have some renal insufficiency do much better with tirzepatide than semaglutide.
Now, what would you suggest for folks who are considering getting on these medications?
I can't emphasize enough the importance of being with a provider that has experience in obesity medicine and weight management, because there are a lot of pop-up clinics, of course, that are starting to offer these medications, and they don't have the depth of experience in understanding what patients should or shouldn't be trying these medications.
And also, too, you don't know exactly what you're getting at some of these pop-up facilities, where if you go to a medical, provider like you know what you're getting, and you're there every step of the way, which is critically important.
Couldn't agree with you more. And I always look at the full picture, including patients' hormones. How is their thyroid? How are their adrenal glands? There's so much more to the picture than just giving these medications.
Yeah, because just giving out and handing out these medications without all of this, medical intervention and knowing what's going on with the patient's health could be dangerous. So you have to have someone like you at the helm helping people with their weight loss journey.
Absolutely. I can't agree with you more in that respect. And I've had so many patients come to me that have had bad outcomes because there wasn't somebody there that worked through those pieces with them on the front end. And that brings me to the point that we must be prepared for the maintenance phase when you do get to goal weight. Just pulling us off of these medications at that point, then having weight regain can be, a slippery slope, and that creates a lot of that yo-yo weight, and that leads to a lot of damage to our metabolic system.
Well, I'm really grateful that you were able to join us today to explain this to our viewers, because I know there's so many people interested in this. So to have someone qualified like you really means the world. So thank you so much, Allison.
Thank you for having me.
And for more information, you can visit agerejuvenation.com/weight loss. We'll be back with more Bloom right after this.
The preceding portion of Bloom was sponsored by Age Rejuvenation.